Good evening, everyone. Thank you so much for joining us today for our stakeholder information session and question and answer period regarding the Quit Smoking with Your Manitoba Pharmacist program, the Social Impact Bond for Smoking Cessation, launching this Friday, April 1st. My name is Tanjeet Nagra, and I'm the CEO of Pharmacists Manitoba. It's a pleasure to be with you this evening. As well, I'm joined with Tim Smith, who's a pharmacy practice advisor for Pharmacists Manitoba, as well as a pharmacist himself, and he's also the co-owner of Simplicity Wellness. We're very excited to be with you. Before we get started, I do want to acknowledge that I'm located on Treaty 1 land, the homeland of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Red River Métis. We honor the treaties that were made on these territories, and we acknowledge the harms and mistakes of the past. We also appreciate the important role that traditional medicines have had for Indigenous peoples in health and healing, and hope to work with all people with respect to their traditions and cultural backgrounds. Thank you so much once again for joining us this evening. We're very excited. This social impact bond, for folks that are on the call, they're aware of it, has been long awaited for some time now. And we're very excited to be just days away, a couple days away from the launch, with many pharmacies and pharmacists on board. So today we're really hoping to give you a bit of a high-level background on what the program is, how it's going to work, and how you can support it, as well as answer any questions you may have about the program. So without further ado, I'm going to pass it over to Tim. However, first I will let you know, if you have any questions at any point of this evening, feel free to either use the Q&A function at the bottom of your screen. Feel free to utilize the chat. Otherwise, feel free to also raise your hand. Hopefully, these are all accessible tools to you on your Zoom. If you're able to raise your hand, I can unmute you if you're unable to type out the question you have. So we'll do our best to answer them towards the end of the presentations, but whatever they come up, feel free to enter them in that way. Great. Okay. Well, without further ado, Tim, take it away.
Great, thank you, Tanjeet, and thank you everyone for joining us this evening and taking time and interest in this program that we are so excited to be able to launch. You've all been sent information already about the program, which is how you found out about it and why you're here. And we really want tonight to be mostly an interactive session where we take your questions and hopefully provide answers and guidance so you can feel comfortable, informing the public about the program and referring clients to it going forward. But first, just to kind of level set a little bit, I am going to do just a brief high-level presentation about the program so that we're all coming at it from the same ground and the same knowledge. So there are many areas of clinical practice where a funded program to support pharmacist intervention could make sense. So why smoking cessation? Tobacco use is a major risk factor in many leading chronic diseases, including various types of cancer, cardiovascular disease, lung disease, metabolic diseases like diabetes, and many more. Smoking is the leading cause of preventable death in Manitoba and, in fact, across Canada. And our province's healthcare system incurs significant costs in treating tobacco-related illness each year. Tobacco is the only consumer product that causes disease, disability, and death when used exactly as intended. In fact, more Manitobans die annually from tobacco use than have died to date over the 2 years of the COVID-19 pandemic. Clearly, there is a need for more resources to address tobacco use. This project is novel in that it is funded by a social impact bond, an innovative tool for funding social services. Rather than being funded directly by government, a social impact bond is funded by an investor, and the program is designed and delivered in partnership between government and a service provider. Should the program meet certain objectives, the investor receives a return on investment while government gains the benefits of the program without incurring financial risk. The government, alongside other stakeholders, identifies the social problem that they hope to improve, the innovative social program to be funded, and the service provider that will deliver the program. The government and the service provider select outcomes that will measure the program's performance. The government pays investors based on the program results. The service provider designs and delivers the program. It works alongside the government to identify outcomes that will deliver a lasting change to the lives of program participants. It collects data to track its progress on those outcomes. In this case, the service provider is Pharmacists Manitoba, and the program delivery is subcontracted out to pharmacies all across Manitoba. The investors lend money to the service provider. The loan covers all the costs of the program. If the program succeeds, government will pay the investors a return. If the program fails, the investors will lose their money. The service provider does not put any of its money at risk. The investor supporting this program is Shoppers Drug Mart Loblaws. The evaluator advises on how to evaluate the program. It checks, verifies, and tests the results reported by the service provider. After an RFP process, Catalyst Research Group from Vancouver won the bid to become the project evaluator. And we are also very pleased to have additional support from Winnipeg-based insurance and benefits provider Canada Life and its subsidiary ClaimSecure, who are supporting this initiative with their technology to simplify and streamline some of the processes on the pharmacy end. So, beyond meeting a vital public health need, this project is also notable in that it is just the second social impact bond in Manitoba's history. And to our knowledge, it is the first social impact bond in the world where pharmacists are the service providers, and also the first social impact bond in the world related to tobacco cessation. And of course, it serves a vital public health need. The program is called Quit Smoking with Your Manitoba Pharmacist and provides participating patients with comprehensive tobacco cessation support, consisting of a personalized quit plan, prescribed pharmacotherapy if the client desires, financial support towards the cost of pharmacotherapy, and ongoing follow-up. Notably, these services are available at no cost to patients. And finally, as mentioned, we have specified outcomes we need to achieve over the life of the program in order for it to be determined a success. This program was originally slated to launch in 2020. However, several delays were imposed by the COVID-19 pandemic and the demands it placed on pharmacies across the province. The original intent was to launch in 3 specific health regions with higher rates of tobacco use. However, we are now set to start on April 1st, this Friday, everywhere in Manitoba. The program will run for 3 years or until the maximum number of participants have enrolled. So now that you have a better idea of the big picture, let's dive a little bit deeper into the details. In terms of pharmacy participation, any pharmacy operating within Manitoba and possessing a valid pharmacy agreement with the government of Manitoba may participate. However, participating pharmacies must employ or contract 1 or more pharmacists who are authorized by the College of Pharmacists of Manitoba to prescribe for smoking cessation. Pharmacists become eligible to apply for this authorization by taking additional training in smoking cessation and behavior change. Participating pharmacies and pharmacists also agree to complete all mandatory program components, such as viewing an orientation session, submitting all required service documentation, and participating fully in the evaluation process. Client eligibility is also very simple. To sign up, clients must be 18 years of age or older, have a Manitoba health card, smoke cigarettes, and be ready to set a quit date. While folks who exclusively use other nicotine products such as chew, snuff, and vapes, or those who are interested only in cutting down their cigarette usage, certainly would benefit from the support of a trained pharmacist. For this program, we are accepting only those who smoke cigarettes and who have complete abstinence as a goal. In partnership with the Government of Manitoba, program objectives have been agreed with respect to the number of patients enrolled and the quit rates we must achieve. For patient participation, we must enroll a total of 4,500 Manitobans over the 3 years of the program, 1,500 of whom must be enrolled within the first 18 months. In terms of outcomes, we must achieve a quit rate of 12% of enrolled patients sustaining smoking cessation at the evaluation periods of 6 and 12 months, and 6% of all patients enrolled maintaining their smoking cessation at 24 months. The patient and pharmacist journey will start with an initial screening process, and if the client is interested and eligible, enrollment into the program and signing of a consent form will follow. At this time, an initial assessment appointment will be scheduled. The initial assessment, which is expected to take up to 60 minutes in duration, consists of taking a detailed health and medication history, establishing the patient's tobacco use history, determining a personalized quit plan, assessing for and prescribing pharmacotherapy if the client desires, and scheduling a first follow-up appointment. Subsequent shorter follow-up appointments are funded to a total of 9 per patient over the 12 months after their initial assessment. If a patient has any out-of-pocket costs for pharmacotherapy after applying any private or public coverage they may have, a product subsidy of up to $100 may be applied at any time during the 12 months. The screening and enrollment process consists of a readiness to acquit assessment that uses a confidence and conviction scale and asks patients their readiness to stop using tobacco products within the next 30 days. If the patient is ready to quit and agrees to participate in the program, the pharmacist will complete the form as documentation of their enrollment. The initial assessment appointment is also scheduled at this time. The initial assessment, which is expected to take up to 1 hour in duration, will explore in detail the patient's medication use and medical history, as well as lifestyle factors such as current alcohol, cannabis, and caffeine use. The pharmacist will assess the patient's history with using tobacco products and their physical dependence on nicotine. Information on past quit attempts, what's worked and what hasn't, is also collected to help inform a customized and personalized plan going forward that includes both pharmacotherapy, if the client wants, and a behavioral plan. Patients are eligible to each receive up to 9 follow-up appointments over the subsequent 12 months after the initial assessment. For each follow-up appointment, pharmacies will receive funding. While the frequency and timing of follow-up appointments is for the pharmacist and client to jointly determine, follow-ups at the 6-month and 12-month mark after the initial assessment are required, and quit status must be assessed and submitted at that time as part of the evaluation process. This week, we are launching a public-facing website with info on the project, a list of participating pharmacies, and links to stakeholders and other useful resources. The URL for this website will be quitsmokingmb.ca. The public can find the closest participating pharmacy to them by viewing a list of pharmacies by health region or using our filterable pharmacy finder map. Pharmacies that have completed all training requirements are listed as being ready to serve. Pharmacies that have expressed interest in participating but have not yet completed all training requirements are listed as coming soon. If your organization is interested in being listed as a resource or has resource materials for clients, let's start a conversation. Finally, a number of marketing pieces are in production and can be sent to your organization in electronic format. If you also wish to have hard copy marketing collateral printed, let us know. So with that in mind, now that we've covered the basics, let's open the floor to your questions and start discussing how we can collaborate together to help reduce tobacco use in our communities.
Thank you so much, Tim. So I see some folks are already starting to use the Q&A, which is great. Feel free, once again, folks, use the Q&A function, use it to raise your hand. We can unmute you, whatever works to ask your questions. And I would be remiss if I didn't mention and just thank members of our board of directors that are here tonight and Pharmacists Manitoba staff, as well as members from the community who are also working towards smoking cessation goals of their own within their own organizations within Manitoba. So thank you for being here as well. And thank you for your support to this program. And I would really like to also mention the Honorable Sarah Guimard, who's here with us tonight as well, who is the Minister of Community Health, Community Wellness and Mental Health. Thank you so much, Minister, for being here tonight as well on the call. So without further ado, we can start answering some questions. Feel free to start sending them in. So first question is, are there any pharmacies in Thompson participating?
Yes, so as of today, there are 2 pharmacies, Safeway, where I worked in January, Naomi, hi, nice to see you, and Shoppers Drug Mart have both signed on so far, and we hope some of the other ones will as well soon.
Thanks, Tim. As well, thank you to folks from Canada Life and Claim Secure for being online as well. Great. Next question is, will the initial assessment be copied to the patient's primary care provider?
That would certainly be a recommended practice, yes. It's not an explicit requirement of the program, but pharmacists are required to follow all normal standards of practice, which, in my opinion, would generally require them to send an update to the primary care prescriber, yes.
Next question, if the patient has comorbidities, morbidities and other medications, what is the general plan regarding offering options?
Sure. Yeah, the initial assessment is so lengthy because it really is intended to be a comprehensive assessment of a patient's health and medical history. And so the pharmacist, together with the client, will determine the appropriate treatment modalities. So whether that is nicotine replacement therapy, one of the prescription options, combinations, behavioral therapy alone without pharmacotherapy, those are all reasonable options. Pharmacists have the scope of practice to prescribe either varenicline or any of the nicotine replacement therapy options. However, some clients may benefit from Zyban, bupropion, which pharmacists do not have scope of practice to prescribe. So it is possible that primary care prescribers may receive recommendations from pharmacists requesting a prescription for Zyban, for example. So it really is a customized, bespoke, tailor-made for the person in front of you program.
Thank you. Any more questions, folks? I think we covered what's in the Q&A thus far. And just to reiterate, I know some folks on the call have reached out to us asking for marketing materials. They will be coming soon. We're just waiting for approvals from all of our partners. So please bear with us. We will make sure to follow up with you and send you those. And I see someone has their hand raised. I will unmute you or allow you to talk here. Go ahead, Lori.
Hi, can you hear me?
Yes.
Hi, Tim, it's Lori Lipinski. Thank you for all your hard work. Really looking forward to this. My question is around the orientation session and the mandatory component of that. I attended the session early on, like probably day one or close to that. And I keep getting emails prompting that I need to attend. I know in, it might have been last night, you said that our pharmacy wouldn't be noted as ready to go if the designated pharmacist hadn't attended the orientation session. So I just want to understand what those emails mean.
Yeah, no, thanks for the question, Lori. So we can look into your situation specifically and see if we do have you recorded as having completed the orientation. If you have, we'll notify you that that box has been ticked and no problem. It's possible that you were receiving emails that were just general, inducing all the pharmacists who want to participate to complete that session, or it's possible that there was a technical glitch and your completion wasn't recorded, but we'll follow up directly with you.
Okay, so I just, duly noted that we would like to be ready to go. My boss and my owner was not able to attend until last evening, I believe he did it. But I am at least one in our pharmacy that have attended it early on. So it would be greatly appreciated if our pharmacy could be noted as ready to go.
Okay, yeah, we'll follow up directly with you to make sure that everything's ready for that.
Okay,
Thanks, Lori. We'll make sure to follow up as Tim stated. Okay, next question has been received. If someone has no coverage, what supports can be offered? Is it up to the $100?
Yeah, so in terms of support for pharmacotherapy, I mean, we do have the $100 subsidy that can be applied to any Health Canada listed product for smoking cessation or nicotine replacement therapy. And so, that would be the primary support for pharmacotherapy. Of course, pharmacists are knowledgeable not just of the pharmacology of medications, but also their availability and price as well. So if cost is, a component that we need to consider, pharmacists can work with the patient to find the most cost-effective answer. And of course, if cost is really a barrier or someone has exhausted, what their financial resources with pharmacotherapy, that's really where the benefit of this program is, combining the pharmacotherapy with the advice from a trained healthcare provider. So the behavioral supports are there throughout the 12 months that a client participates in the program. And in fact, for some clients, they may not want pharmacotherapy at all. So they might just be receiving the behavioral supports.
Thanks, Tim. Next question is, can you confirm the participant's income is not an eligibility component?
That's correct. Yes, this program is open to any Manitoban age 18 and over who smokes cigarettes and is willing to set a quit date with a goal of total abstinence.
Thank you. So as folks enter in more questions, perhaps I can ask one. So Tim, I think you mentioned this already. Perhaps you can give a demo of how someone could find a pharmacy near them that is offering these services.
Sure. Yeah, I was just going to share my screen. I've got the website, which is not live yet, but you can get a behind the scenes look early tonight. So let me just pull that up here. Okay, hopefully you can see that now. And so we have a landing page here at the front, really calling to action people to find their reason for quitting tobacco. And so for people who are ready to find that pharmacy, at the top, we've got a list of pharmacies. And they are broken down by health region here. So you can look, whether you're in Winnipeg, Northern, Prairie Mountains, Southern Health, or Interlake, Eastern, you can click on your health region and see a list of participating pharmacies. They're indicated by color whether they are currently providing the service, so i.e. they've completed all program requirements in terms of the training and eligibility, or ones that where quit services are coming soon. So this would be pharmacies and pharmacists that have indicated their interest, their intent to participate in the program, but who may not have completed the mandatory orientation session yet. So most of the coming soon ones, I think we can probably expect it won't take them too long to get on board. The orientation requirements are not particularly onerous. And so you can see by scrolling down throughout the region and so on. If you just go back to the other page, you can also look at it just from a map format here. So we can enlarge that. And so we can filter by health region. We can see a list of pharmacies by health region here, or of course, we can just zoom in and take a look. So the map is fully interactive. And you can see that there's a really great distribution of pharmacies throughout the province, in all geographic areas, and a good blend between Winnipeg, metropolitan area and rural areas of the province. I should also note that for Northern Health Region, for fly-in Indigenous communities throughout the area, Spirit RX, which is located in Winnipeg, is participating in the program. And so they'll be able to serve communities like that. And we hope to bring on board a couple of the other pharmacies who provide services to remote communities elsewhere in the province.
Great. Thank you, Tim.
And then we also have on the website a public-facing FAQ document, so just helping to answer some of the questions people might have about the program. As we have more questions come in, or we hear from pharmacists, these are the questions that they're facing, or questions that you think the public might have, feel free to submit them to us, and we can update this and kind of keep this a live document. And then, as mentioned, we have a list of resources that is in its infancy, but we hope to get more of your organizations on board here. And if you have resources, tools, tips, or just want to link to your organization on the website, we're happy to add that to our list here as well. So please feel free to send those to us.
Thanks for that, Tim. So I'm just going to send in the chat Tim's email as well as the Pharmacist Manitoba email where you can get in touch. If you don't have any questions right now, that is absolutely okay. But if you want to take some time to think about it, reflect on it, and reach out to us with your questions or suggestions, feel free to do so. So I've just sent that in the chat now. Not seeing any more questions. Oh, actually, there looks like there's someone with their hand raised. Oh, actually, no, it went away. So it doesn't look like there's many other questions. So maybe we'll give everyone a moment here. Feel free, once again, you can utilize the chat, you can utilize the Q&A function, you can raise your hand, and then we can unmute you. if you'd like to ask a question. So we have a couple here. When billing to claim secure, if patients don't have any other coverage, will a dispensing fee be covered by claim secure? Are these claims adjudicated in real time?
So yes, the claims are adjudicated in real time, and that was the real value that Claim Secure is providing here. Their technology really allows us to have a comprehensive real-time solution. And if client does not have any coverage, like ultimately it's a subsidy to cover $100. There is no requirements on the pricing. It's really however the pharmacy would standardly price that, whether they're billing it to a third party or for a client who doesn't have any insurance coverage, it's a $100 subsidy towards that cost. So of course, pharmacies can use their standard billing practices.
Great. Next question. Has there been any information sent out to healthcare providers, nurses, doctors, etc., so they can refer patients to pharmacies? That's a great question.
Yes, so we have sent out kind of a stakeholder engagement email that went to a number of different organizations across the province, including Doctors Manitoba, I believe the Nurses Association as well as all of the regional health authorities. So we are, of course, relying on people within those organizations to help cascade down the information to people working the front lines. And of course, we're relying on our pharmacists all across the province to be champions of this program in their community and to engage with their local prescribers and other healthcare professionals. And we ask you to do your part as well. So if there's any, within your organization, within your community, within your family even, we would love for you to be champions of this program and help get the word out. We're also going to be launching, a real public-facing campaign. We're going to have a media event on Friday, and you can expect to see advertisements, op-eds, marketing pieces, and the like popping up across the province very shortly.
Thanks, Tim. Next question, what is the messaging about vaping as a smoking cessation aid? Good question.
So I recognize that this is certainly a controversial issue or topic, in many quarters, and I know there is, studies ongoing, and that the evidence is, evolving with respect to the use of vaping as a smoking cessation aid. Ultimately, pharmacists, as all healthcare providers should be, must be client-centered and meet their clients where they're at. That said, generally we are going to endorse the licensed products that are approved by Health Canada, whether that's nicotine replacement therapy, varenicline, bupropion. Some clients may not be willing to go down that route, and so I think it's incumbent upon all healthcare professionals to meet clients where they're at. But I don't believe that openly endorsing vaping at this time is the best option. But that's a personal opinion as a professional, I suppose, as opposed to an organizational answer.
Thanks, Tim. Okay, I'm not seeing any more questions at this time. Maybe once again, we'll give you another minute. If there's anything else that comes up. Otherwise, once again, in the chat, I will send Tim's email as well as our general email. Feel free to get in touch if anything else comes up, or if you have any suggestions, questions, comments, concerns, we would love to hear them. And we're really looking forward to having all of your support. So thank you again for logging in this evening and spending some time with us and getting to know a bit more about the program. And thank you in advance for all your support for the program as well. We have been receiving very positive feedback in our stakeholder communications, and we're very excited to see how many individuals and organizations are willing to support the initiative. And we're all working towards a very important goal in our province, and that's to combat as smoking, and hopefully aiding other diseases and causes that come from smoking as well, and mitigating those issues. So we're very much looking forward to this. It's going to be extremely interesting program, very unique in itself, as Tim explained, being a social impact bond. And it's an opportunity for community pharmacists to really show and community to see how valuable a pharmacist can be to many other causes, in addition to just dispensing prescriptions. So we're really excited about what this opportunity can bring for the profession. Okay. I'm not seeing any other questions. So with that, perhaps we can come to a conclusion. Tim, did you want any final last words here?
Just thank you all for your engagement and support. This is going to be a 3-year journey, and we really hope to deliver success on this. I want to reiterate, nearly $250 million a year this province spends on tobacco-related illness, and nearly 2,000 of our fellow Manitobans die each year as a result of tobacco-related illness. So, we're all stronger when we work together. So let's crush tobacco-related illness.
Thank you, Tim. Okay. Thank you, folks. We'll close things off there. We will hold on to the recording. So if anyone hasn't missed anything, or if anyone wasn't able to attend, we will be happy to share it as well. Feel free to get in touch with us. We're really looking forward to this Friday when we launch this program province-wide officially, and we launch our website and everything as well. And all the information will be accessible on there. Thank you again for tuning in, and enjoy the rest of your evening.